Good day, everyone. Thank you for tuning in. My name is Tsafnat, and today I want to talk to you about what is arguably the most important problem on the road to automation of systematic review production. But first, and by way of further introduction, I'd like to declare that this presentation represents work that my colleagues and I have developed over several years. Some of these have been published in the scientific literature and are embodied in the International Collaboration for the Automation of Systematic Reviews, which I helped found. In order to disseminate these ideas more broadly, I have pursued a commercial route by launching a private and for-profit company called Evidently Proprietary Limited, which licenses technology that my team and I developed at Macquarie University. As a major shareholder and director in Evidently, I stand to profit financially, although indirectly, from this presentation. The promise of automatic systematic reviews, in no particular order, are to reduce waste, both by making systematic reviews that adhere to a high standard of publication and that don't unnecessarily repeat previous studies. To increase the number and variety of topics that are being summarized by systematic reviews, by making reviewing more accessible to a bigger number of reviewers, answering a variety of questions. To reduce the number and complexity of skills that are prerequisite to conducting a good systematic review, so that reviewers can start reviewing faster than they otherwise would. And finally, to increase the timeliness with which evidence gets to the hands of practitioners. This includes shortening the time it takes to conduct and disseminate a review, but also the time it takes to update a review. These goals are, of course, not independent from each other. If we reduce waste, we increase the overall number of high-quality reviews that are produced and therefore also the number of topics covered. If reviews require less skills, we increase the number of reviewers that can work on a review and therefore accelerate the process. It is a bit more complicated when we also want to do all this without sacrificing quality, but we can manage that. So let's look at how this is done in practice. Today, the general approach to automating the production of systematic reviews is through a classic divide and conquer approach of breaking down the process to discrete tasks that are easier to automate. The rationale for doing this is that conducting a review is not only cognitive, but requires multiple skills, and AI are manageable when they conduct single, well-defined tasks. So in this case, where the tasks are so inherently different from each other, it is not surprising that different groups around the world with their respective strengths and interests choose to focus on AIs for specific tasks. Once we've done all that remains is to put all these AIs together, and that's easy, right? In 1988, Hans Moravec made the observation in the field of robotics that it is paradoxically much easier to get a robot to conduct cognitive tasks, like complex maths, and much harder to conduct the trivial tasks like walking or crawling. This applies more generally in AI. It is easier to automate the highly cognitive but well-defined task of a systematic review, such as creating a forest plot, but it's much harder for a variety of reasons for an AI to read a PDF, say. Some people might think this is intuitive nowadays, but I'm here to tell you that we still, even though we see this, we still forget how computers think very differently to how human brains perform tasks, and that the tasks that people perform are not necessarily the tasks that computers perform. So Moravec's paradox teaches us that to evaluate the relative importance of task automation, we need to consider not just how people perform this task, not just what AI is available to automate them, not how hard it is for people to perform these tasks, because our perception of what is important may be skewed. We need to think about what's going to actually help us reach the goals I started with. Let's look at some numbers to determine that. So this table shows the consensus perception of very experienced systematic reviewers of how much time they spend on each task. If we sum up these times, we get the number of days to conduct a systematic review is 21.5 days. The graph on the bottom shows effort, but I want to draw your attention in particular to the last column here. It shows that if any task was perfectly automated, that is, if it took 0 effort and no time at all to perform, how would that affect the overall time it takes to create a systematic review? So notice this column shows us that most tasks don't need to be automated because they don't take much time at all anyway. For example, finding systematic reviews, previous systematic reviews that is, only takes half a day or 1% of the review time. Other tasks like title and abstract screening and extracting information from full text take a moderate amount of time, around 20% each of the review time. And so they're more important to automate. So much for perceptions. Let's validate them. Okay, so some simple maths here. If we take as a baseline that the median time to conduct a systematic review is 23 months, or say 700 days, we can explain 21.5 of these days by tasks in the previous slide. That is the core task of conducting a systematic review. We can explain another 17.5 days accounting for weekends, breaks in between tasks, sick days. So now we're at 39 explained days. Let's say that peer review, which is including submission, revision, editing, you name it, and everything else, it takes 6 months. These are accounted for in the 700 days, but they're not in the 21.5 days. So we can now explain another 183 days or so, which means we're now at 222 days to conduct a review. Let's add 30 days more because, well, why not? We'll account for holidays and for any other things we haven't accounted for yet. So if we explain that there's 252 days all up, and what does that leave us? Well, the math says 448 unexplained days. That's right. That's 2/3 of the systematic review time are unaccounted for. It means that even the tasks that look like they have potential to moderately improve the review time can actually save only about 7% of the time. So it's not so moderate anymore. So are they still worth automating? So what's going on here? Where is all that time going? To find out, we followed systematic reviewers as they go about their work. We conducted an ethnographic study. We interviewed them. So I can now tell you where all that time goes. It goes towards work that people don't perceive to be doing. What people call work as imagined. Work as imagined. These are the tasks from those core tasks of a systematic review we mentioned before. These take much less time than we thought. So work as done is spent on tasks that are not even considered part of the review. These is writing emails, downloading data, formatting references, converting units, converting file formats, cutting and pasting, any other imaginative task. The first implication has nothing to do with automation. The first implication is that we sometimes think that to produce more systematic reviews faster, we need more highly skilled systematic reviewers to perform core tasks. But what we actually need are unskilled assistants to help with other tasks like email, EndNote, maybe even a bit of Excel. Let's call all these the silent tasks. These are the dark matter of systematic reviews, the things we don't see. So how do we automate the silent tasks? So once we uncover what that dark matter is, what those silent tasks are, we can work on automating them. So to automate the silent task of a systematic review, basically need three things. We need interoperability. That is, we need that tools that automate core tasks be able to talk to each other through a common language. That way they can transfer information directly from one to the next, and we don't need to copy and reformat and so on. To do this well, we need open standards that allow us to represent the information about clinical trials and other types of studies that we need in systematic reviews in a standard common way. With open standards, developers of individual single task tools can work independently from each other and still be confident that their tools can be integrated with others so that they can be useful in practice. And last but not least, we need the flexibility to compose the individual task tools in different ways depending on the question we're trying to answer in our review. It allows us to pick and choose the right tools for particular reviews we're working on. This is what's called loose coupling in engineering. It often means that tools take their inputs and produce their outputs using the same format. And through an agreed process, ideally using the same open standard that are the tools use internally to facilitate that sort of communication between the tools. Loose coupling ensures we can answer a rich variety of questions. We can take data from different sources. We can you can use all kinds of clinical and non-clinical domains that we might want to study. It gives us versatility that the other two components in isolation do not. So let me show you a couple of examples of this in action. Before I show you the examples, I want to take a minute to show you how we're doing this in practice. The Piano Research Automation Platform aims to automate the silent tasks. It provides interoperability for core task automation tools using the RIS 2011 version and the REST open standards. It has a large and growing core task automation tools toolbox that lets you create the workflows for research on a large range of systematic review questions. We encourage the use of third-party automation tools on the platform, and we provide a number of documented APIs in R, in Python, and in REST with examples, so any AI or rule-based automation can be added and immediately used in a systematic review. Remember that the aim of Piano is not to automate reviewers, it is to remove the mundane, tedious, silent tasks that nobody wants to do anyway. Information from one tool effortlessly flows on to the next. There's no copy and paste, no reformatting. The research workflow in Piano is self-documenting, meaning that research is transparent and reproducible. It's ready for peer review and collaborative development. So now you have a clear view of what we do. Let's look at these examples to see what we do with it. Before I show you the examples, I want to take a minute to show you how we're doing this in practice. The Piano Research Automation Platform aims to automate the silent tasks. It provides interoperability for core task automation tools using the RIS 2011 version and the REST open standards. It has a large and growing core task automation toolbox that lets you create the workflows for research on a large range of systematic review questions. We encourage the use of third-party automation tools on the platform, and we provide a number of documented APIs in R, in Python, and in REST with examples, so any AI or rule-based automation can be added and immediately used in a systematic review. Remember that the aim of Piano is not to automate reviewers, it is to remove the mundane, tedious, silent tasks that nobody wants to do anyway. Information from one tool effortlessly flows on to the next. There's no copy and paste, no reformatting. The research workflow in Piano is self-documenting, meaning that research is transparent and reproducible. It's ready for peer review and collaborative development. So now you have a clear view of what we do. Let's look at these examples to see what we do with it. The first example I want to talk to you about is title and abstract screening. Earlier, we said that this is one of the most time-consuming of the core tasks to perform. So it stands to reason that automating it would benefit the process. Before we look into whether this is true, let's remember that the task of titles and abstract screening was invented in the aisles of libraries. It was invented at a time when reviewers had to sit on stools in the aisles and go over journal indices issue by issue, abstract by abstract. It was designed as an optimization of the screening process to accommodate for people's valuable time. Now, computer time is much less valuable. So if systematic reviews were designed to be produced by computers, we probably would not have this task at all. The reason we try to automate rather than eliminate this task is that we didn't think of automation of the silent tasks. Let me explain this further. With interoperability, open standards, loose coupling, we don't need to think about single task automation as independent of the review process. Because we already have a different way to simplify its design that those elements give us. Even better, the single task automation tools are no longer in need to be hardwired to work in a particular order. So this gives us entirely new options to reduce waste, save time, reduce reviewer skills, and increase topic coverage. We can take advantage of information extraction and full text fetching automation, for example, before screening, because they now take a hell of a lot less time to do thanks to core task automation tools that have already been developed. We know that when we use information extracted from the entire paper to screen studies, it gives us 5 to 10 times more precise results than title and abstract screening alone, and without compromising recall. Now it can also simplify the workflow because we can screen once instead of twice. Now it's true that we did have to increase the number of documents that we needed to obtain full text for and extract information from. In other words, automation tools for core tasks still play a pivotal role, but loose coupling and automation of the silent tasks allowed us to compound this benefit by re-optimizing the process for automation. The second example I want to talk about is in extracting information, such as study characteristics from data and data from text. This is a general model for AI-based extraction. Almost all published systems that extract key information from clinical trials follow this model. It is a classic machine learning pipeline that trains a classifier to identify individual sentences or phrases as being descriptive of the population or author affiliation or the number of randomized patients According to this model, we only need to vary the training data to get a different algorithm. In other words, we assume that if we train this model on one type of information, it will extract that kind of information. If we teach it to recognize outcomes, it will learn to extract outcomes. If we teach it to recognize population, it will extract population. For some reason, we think that the same tool should be able to extract all these different types of information using the same model. We know that information is presented differently in text. So when we put it like this, I hope this begins to sound maybe a bit silly, because the different information, when it's described differently in text, why would the same model be suitable to extract all these different types of information? In fact, we see that the performance of information extraction tools has not improved much in decades, but we still keep doing it this way. So why do we do this? Well, probably because we model automation how people do it. We don't use different people to extract different elements from the same paper. So we don't think we need multiple automation tools. Moravec's paradox is in play. We don't notice that the silent task of reading words from text is actually very complex, and then we don't remember that computers process data very differently to us. But we use the same person to extract all different kinds of information, because understanding text is easy for us humans. So we don't need an expert in, say, extracting patient numbers or an expert on extracting outcomes. If we did, the systematic review would be much more expensive. It would take much longer because we're adding a lot more silent tasks. So how can we take what we already know that computers do need specific expertise in the extraction of different data types? How do we put this knowledge to use? When the silent tasks are done away with, when we have interoperability, open standards, loose coupling, we can split the single core tasks of automating information extraction into micro tasks and allow them to work together in the same systematic review. So each micro extraction automation tool can now focus on very specific patterns and be really good at it without having to make compromises for other types of information. For example, we can use a tool that extracts mentions of cancer gene names together with a tool that extracts and identifies the type of clinical trial we are looking at. We can use a tool specifically for extracting interventions together with a tool that extracts, say, citations from BMJ papers. We can use a tool that extracts data from tables with a tool that extracts data from images. Whatever is the most suitable for the particular review we're working on. So if you will indulge me on a soapbox for 1 minute, I'd like to address an elephant in the room that has been lurking, well, a virtual room, for some time. Another reason we automate systematic reviews the way we have been is that the way we use AI. Machine learning, natural language processing, image recognition, all these AI methods are very fashionable. They're very sexy. That means that tools that automate these tasks that people perform, especially experts perform, are much easier to get funded and to publish than tools that solve problems that are perceived to be easier. So it's easier to get funding for a tool that extracts all of the pico elements, for example, or even more elements, than it is to publish a micro extraction tool for only population or only citations from BMJ papers. The people who edit the research, those who get to decide what will get funded and published and what will not, which are actually the same people, but wearing different hats, also don't see the silent tasks So they also don't see why automating the trivial tasks is so much harder. And so they favor funding and publishing tasks that look hard, regardless of whether they solve the systematic review problem or not. In this instance, incrementalism fails us because automating silent tasks is not worth doing for its own right, and so we cannot get the benefits of automation to support more research on automation of systematic reviews, and even on the core tasks that are perceived to be hard. That's, by the way, is the main reason I started Evidently, because it allows me to rely on other forms of funding to automate systematic reviews. In conclusion, the tasks that are more easily automatable by AI are not necessarily the ones that provide the most bang for the buck, but they are still necessary. Automating cognitive tasks is important, but automating the silent task compounds the benefit. It's less sexy and harder to get funding because it might not be as cool, but it's still worth doing. Interoperability, open standards, loose coupling are the best way to automate silent tasks because they do this really well. They allow other automation tools to be developed independently and used together, and they have some nice side effects that we actually need. With those, we can compound the benefits of automation to focus on the end goal, reducing waste, increasing topic coverage, lowering the skill barriers, and shortening translation time. Thank you again for listening. If you found this presentation useful or infuriating, confusing, or anything else, I would love to get in touch with you to hear your thoughts. My email address is on the screen, and I'll be at the Q&A session coming up.